The cholera pandemic dates back to the early 1800s in the Ganges River Delta. Jumping forward, in the past several decades, a 99.9 effective treatment had been created, which led to the saving of over 1.2 million lives a year. Prior to 2010, a vaccine for prevention had been created and inventoried in bulk to provide for a speculative emergency relief for the future. Additionally, this vaccination had been approved by the WHO. The goal of these efforts is to begin regular population vaccinations in areas that are in desperate needs of it. Dr. Margaret Chan, the Secretary General of the WHO, brought up the sad reality that smaller regions commonly cover up outbreaks when possible, just to keep tourism and the money that comes along with it strong. This act further exacerbates the local issues as well as spreads cholera to unsuspecting and vulnerable tourists that are located around the world. Despite this, the WHO reports good news with its vaccine metrics. The WHO states more cholera vaccines have been deployed over the last 2 years than the prior 15 years combined. The International Center for Diarrheal Disease Research, the ICDDR, located in Dhaka, Bangladesh, was originally funded in 1960 by the United States to serve as a local research facility where there is a high number of diarrheal disease. The campus also acts as a satellite research facility to protect the U.S. from diarrheal diseases before they ever hit U.S. soil. The ICDDR has played a significant role in the local treatment as well as global research for the diarrheal disease of cholera. It is currently responsible for curing over 220,000 patients a year, of which almost all recover within 36 hours. This soft diplomatic effort has led to a significant impact to the local population. Because of the desires of a higher income country, there's a more formidable healthcare infrastructure system located in a relatively unlikely area for such state-of-the-art and innovative research. While the benefit of this initiative is not directly quantifiable to the United States, it is undeniably invaluable. For the ICDDR in Dhaka, during the rainy seasons, there is a substantial increase in the number of patients where the facility usage is pushed to its limits. Forward operating tents house cots for patients of cholera, but without funding, who knows what type of conditions this type of influx would have in the local community. The New York Times Global Health reports there is an unexpected smell that comes from this diarrheal treatment facility. The Times continues, it doesn't smell as expected. It smells like disinfectant. This is due to the high degree and high level of sanitation that occurs in this facility. This local sustainable effort extends to the education of the local population, which teaches parents how to take care of their children as well as provide for affordable and proper nutritional cooking techniques. A differentiating factor at the ICDDR is the immediacy at which patients are seen and worked on upon arrival. Those with severe cholera will have an IV inserted to them within 30 seconds. This type of service is unheard of for these types of regions, especially when 33% of the local population lives in the slums. While the economic infrastructure is not typical of a developed one, its healthcare system in diarrheal diseases is more closely related to one that is more developed. An estimated 200 million vaccines is needed for vaccination success throughout Bangladesh. The local populations have concerns because although there are vaccines, there is still much discussion on where these vaccines should be used by the intervening countries. While the WHO says that true long-term cholera improvements are determined by quality water supply, proper sanitation, food safety, and general community awareness of prevention methods, there is a need for alternative intervention such as vaccines and treatment. Actions have been taken to improve health infrastructure. However, when a large population has no other options but to live in the slums, it becomes that much more of a sustainable health initiative challenge.